Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, Meldita's Info Corner. My Facebook is johnrigacho@yahoo.ca. Okay, kidney transplant. So this is my second video. I have a drawing here. It's not perfect. So this is the left kidney. This is the patient's urinary system. This is the left kidney. That is the right kidney. We have an abdominal aorta. The renal artery is connected to the abdominal aorta that delivers blood to the kidneys. Okay, and we have also here the inferior vena cava. The renal vein is connected to the inferior vena cava that drains dirty blood from the kidneys to the right side of the body. Okay, the abdominal aorta, as it goes down, it divides into two: the right iliac artery, the left iliac artery. The inferior vena cava, as it goes down, it divides into the right iliac vein, into the left iliac vein. We have the two ureters, okay, and we have the urinary bladder. And this is going to the urethra. On my left side is a kidney donor, okay. This is the right kidney donor, and we have also a left kidney donor. It's already done here, but this is still going to be connected to the patient. Okay, so this is a right kidney from a donor, okay. So the transplant doctor will leave a part of the renal artery, a part of the renal vein, and a part of the ureter. So the implantation of this donor kidney will be on the lower abdomen, and the connection will be done here at the iliac vessels. So the renal artery is connected to the iliac artery. The renal vein is connected to the iliac vein. Before connecting the ureter to the urinary blood of the patient, the transplant doctor will insert first the urethral stent, okay? And the upper part of the stent is located at the renal pelvis, near the opening of the ureter, and the lower part is connected into the urinary bladder. So once that is done, okay, then that's the time the doctor will suture this ureter to the patient's urinary bladder. Okay, so we have here a stent. Okay, this is a urethral stent. The upper part goes to the renal pelvis, and the lower part goes inside to the patient's urinary bladder. It is a hollow tube. There is a big internal opening. That's where the urine flows out from the kidneys down to the urinary bladder. Okay, and we have also several holes outside this tube to help out in draining urine from the kidneys to the urinary bladder. And the patient has already a Foley catheter, and that's where the final flow of the urine goes out. And that Foley catheter is connected with a drainage bag. Okay. So our donors' kidneys come from the following. Okay. So donor kidney can come from a living donor. Okay. And they are actually out of the hospital, and they could be relatives or blood ties. They are the best match for the patient if they agree. We have friends and good Samaritans that agree that if, you know, that they are willing to donate one of their kidneys to help out people waiting for transplant. There are also donor coming from the hospital. An example of this are ventilated patients with irreversible brain damage, but their kidneys are still healthy. And they actually, before something happened to them, actually, these people agree that they will donate their kidneys because they have a donor card. And if the family member that expired, if the family members that expired are young, sometimes the family can make a decision to help out other people waiting for kidneys. Okay? And sometimes the donor is a person or persons who died suddenly. Okay? These are the so-called cadaveric donor or non-living donor. And actually, they too agreed before that if anything happens to them, they can actually, if anything happens to them, they can actually donate their kidneys. Or maybe a family, sometimes the family can make a decision to help out these people who are really in need of kidneys, new kidneys. Okay. And some say that the cadaveric kidneys, they could be good for 24 to 48 hours if preserved. Some say they are good for 24 to 36 hours when preserved, okay, before transplantation. Okay, so this is the right kidney donor. And this is the left kidney donor. With regards to the stent that I showed you earlier, sometimes the doctor will remove the stent, urethral stent, after a day, a week, 2 weeks, or 3 weeks, and that is based on his decision. Okay, so the next video will be about preparation before kidney transplant. Okay, thank you.